Okay, so for this task, we are going to be doing an ear cytology. So we have our patient, we've got our saline, our sterile cotton swabs, and our slide. So we will take one of our cotton swabs, apply just a little bit of saline, and then we want to gently place it into our patient's ear, kind of roll it around, but without harming our patient, still getting a good sample. So, again, good job. So I'm going to go from this way so I'm not walking. All right, hi. So we go in and make sure. Good job, bud. There we go, that was it. Once we've collected our sample, we're going to apply it onto our slide and roll it onto a single layer. And we can, making sure we're not going back over it. Once we've done that, we will bring it to our lab section. We'll give it a good wave to dry it. You can put her down. And then we want to heat fix it with our lighter, which is tough to do. I'm not good at. I'm really bad at lighters. I wonder if this one's empty. Let me try this one. There we go. So we heat fix it. And then we are going to dip it into our stain. So we start with our fixative, and we want to do 10 1-second dips. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we want to do our eosin, our red stain. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then lastly, we do our blue stain. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we want to very gently rinse off our excess stain. So just want to use a little bit of water, get that off, and then we'll wave it dry. And then we're ready to take it over to our microscope to examine it. Okay, so now we are going to evaluate our ear cytology under the microscope. So we start, as always, on low power, and the way that we are going to take a look is in kind of a zigzag pattern. Start at one side, go all the way across, go one field down, and then go all the way back, and keep repeating for the whole duration of the sample, so that way we're sure we're not missing any spots. So we'll start here, low power, and then just kind of get our slide into focus. And on this, there's not really a ton that you can see yet, except some of the larger, more obvious debris and dirt. From there, we go up, and here too. See a little bit of just normal debris, some hair. Go to our 40. Take a look again. And again, we're still just seeing some moderate debris. No ear mites, which is good. So now what we'll do is go to our high-powered one, and we'll place a drop of immersion oil to help us visualize better. It kind of reduces the space between the slide and the lens. So from there, now we'll start and do our zigzag pattern. Okay, so on the high-powered, this is where you'll be able to see yeast, bacteria, different kinds of skin cells. Our yeast kind of looks like little peanut-shaped things. For bacteria, sometimes you'll see cocci, which is the circle, kind of spherical shaped. Sometimes you'll see bacillus, which is the rod-shaped bacteria. As far as this sample goes, it's pretty clear. There's a little bit of debris, occasional yeast, but nothing really out of the ordinary. Maybe 1 to 2 every couple of fields. And then, so we just want to make sure we're thoroughly looking at our sample and not missing anything. And then always when we're done, we'll have the veterinarian take another look. Okay, but as far as this sample, it looks pretty clear. So what we'll do now is clean up our area, take our slide off, we'll take our chem wipe and just make sure that we're leaving the microscope clean and ready for the next person. And then we'll record any of our results into the record. Okay, so now we are going to look at some common things that we see in ear cytologies. So oftentimes we'll see some bacteria. This is bacillus bacteria, it's the rods. We don't see these as often, but you can definitely see them if a dog has a bacterial infection in their ear canal. Another type of bacteria you might see is the cocci bacteria. They're more round and spherical. I'd say when we see ear infections that are bacterial, we usually see these more often than the bacillus, but there are these the tiny little spherical round shapes that indicate bacterial infection in the ear. Moving on, this is what we kind of see most often. This is Malassezia, also known as yeast. And these are usually, they look like kind of little peanuts. Also heard them described as shoe prints. So when we see this on our cytology, we know that our patient has some yeast present. Sometimes it's numerous and overgrown, causes issues. The last thing that we see sometimes in our ear cytologies is ear mites, which is one of the less pleasant things to see. You see them not as often as we see other types of infections, but we do see ear mites on an ear cytology every once in a while as well. So those are just some examples of things that you would see or could see in your ear cytology.